Welcome to the PharmaVOICE 100 one-on-one video series with Karen Groen.
Deb, congratulations on being named to the 2020 PharmaVOICE 100.
Thank you. It's great to be here today.
And thank you for joining us for our celebration marathon.
Yeah, this is very exciting.
Deb, what is the biggest trend you're tracking right now in terms of global clinical operations? I know you're an expert in this field.
Clinical operations is pretty exciting right now. I'll start with just clinical trials overall. So we are seeing, based on the COVID challenges in front of us, we are seeing a real big boom in COVID studies that are coming into our workforce. Really, really exciting for our staff to get the opportunity to work on those studies. They want to be part of the solution. So on one hand, challenging times. On the other, presents really good opportunities for our staff to be part of the solution. So that's really exciting, great. The other thing we're seeing certainly is a shift in just the workforce and where they work. So a lot of people have been forced to do their job remotely. For some people, they were already decentralized. Not a big change. But the part that was a big change for them is a large part of my workforce are called clinical research associates, or known as CRAs in the industry. They're very used to doing 70 or 80% of their job going physically to hospital sites. They have to go in, they do the monitoring, they meet with the primary investigator. This came to a sudden halt with COVID, whereas they couldn't go into the hospitals either due to regulatory guidance, hospital guidance, local guidance, and they had to find a way to do their work remotely. So what we had to do is implement what's called centralized monitoring or remote monitoring. And for the workforce, this was quite challenging because they had to rely heavily on technology. So for example, they had to be able to do meetings like this. They had to do teleconferencing, Zooms. They had to rely on more extensive telephone calls. They had to do certain things like Google Goggle, all kinds of different things to be able to physically see what was going on without physically being at a site. So that was quite challenging, but it did open the opportunity for people to leverage technology better. We've been using technology in clinical trials and in clinical operations for a really long time, but people are still very dependent on that in-person traveling and site visits. So this forced us to jump a little bit ahead, say, look, we're going to have to be more reliant on things like remote monitoring, centralized monitoring, and we also had to help a lot of the sites and our sponsors leverage things like telemedicine, right? Because they also couldn't get the patients into the hospital for the visits. So we had to work with a lot of clients in a lot of countries to implement new ways in which patients could be treated. At the end of the day, for us, it's all about patient safety, helping the PIs to treat their patients and to keep the clinical trials going. And to do that, you have to really rely on the technology. So big trends, change at times, but huge opportunities for really the pharma and CRO industry, but for my staff as a whole.
Wow. And speaking of your staff, I know you lead a global team of thousands. What is like the best part of your job there? Because I know you love it.
I do love it. I have about 5,000 people across 52 countries. While that sounds overwhelming at first, I will tell you it is the highlight of my job. Of course, I don't get to go visit all of the people. And of course, with COVID, I've actually been working from home for the last 5 months, like most people. But just spending time with them, whether it's through video conferencing or before COVID, actually getting out there and spend face-to-face time, I learn the most from them, right? So understanding people's culture, learning to appreciate the differences, understanding where you actually can do things globally and follow global processes, and where you need to respect local processes and local differences. So a lot to be learned. A lot about that is super exciting because, again, changing regulations all the time, change in different requirements. I learn through my staff. So I think that's probably the most challenging and yet fun. And then I will also say, you can, I don't want to say cheat a little, but you can almost do the follow the sun model, right? So if you got people all over the globe working, you can be done in one area and you can pass it off to someone else and ask them to finish it up. You come in the morning, you get it in your inbox, right? And vice versa. So a lot of benefits for me as a leader to have people who I can trust and rely on around the globe. And I will say you sometimes can get the absolute best A team by having a large population of people in a lot of different countries where you can actually say some of the best talent sits in Europe, some of the best talent may sit in Asia, and you can build an A team by pulling from the best in all locations. So a lot of fun, ability to build great teams, and an opportunity to learn as a leader.
Awesome. Thank you so much. This is great content. Thank you so much for sharing some of your lessons around the world, and congratulations again.
Great. Thank you. Thank you so much. I really appreciate taking the time to chat with you. Thanks again.
For more PharmaVoice 100 content, visit www.pharmavoice100.com.